What genetic mutations are there in CLL? How are they found?
Several genetic mutations have been identified in patients with CLL that can influence the disease course and their response to treatments. Some of the commonly noted mutations in CLL are TP53. This mutation is associated with poor prognosis in patients with CLL, typically a shorter time to starting therapy, as well as inferior response to certain types of therapies in CLL. ATM gene deletion is another gene mutation that is noted in CLL, and that's been associated with adverse prognosis as well as resistance to certain types of therapies. Notch1 is another mutation that is associated with poor prognosis, adverse disease, as well as resistance to certain therapies, namely chemotherapy in patients with CLL. SF3B1 is another gene mutation that can be sometimes associated with indolent disease. This is another gene mutation that can be identified through our next-generation sequencing techniques. These are just some of the gene mutations that are noted in CLL and can be diagnosed via FISH as well as next-generation sequencing techniques. However, it's important to note that patients may not have any of these gene mutations, and there are other patients who have other gene mutations that are not noted in this list.
What is Healthtree University? Studies have shown that educated and empowered patients often have better outcomes. Healthtree University is the first and only free, comprehensive curriculum for patients and caregivers. Create a free account to gain exclusive access, where you can watch our newest unreleased videos, easily explore topics through our organized courses, and assess your knowledge with interactive quizzes. Visit Healthtree University and become an empowered patient today.